Our focus is on the medical corner with my special guest, a cardiologist who not only treats people with heart disease, but is a great believer in prevention. Dr. Joe CeFalu, welcome to Living Fit. And we're going to discuss for today's segment, Dr. CeFalu, what blood work really means. So many people, or everybody, gets their blood work done, but there's a few tests, a few numbers, they really don't understand how it pertains to heart health.
Right.
And we're going to start off with the one that everybody hears about, cholesterol, but they don't know what the numbers mean, and they really don't know how cholesterol affects health, our heart health.
Right. Extremely important, Bill. You know, we hear a lot about it on TV, hear a lot about it in the media, and fortunately we know now that we didn't know many, many years ago that cholesterol can, treating cholesterol can prevent heart disease. Cholesterol number, total number is very important. You know, everybody looks at the number of 200 as the magic number, but it really needs to be more in-depth than that. We like to look at good cholesterol and bad cholesterol.
HDL,
HDL and LDL, right. The HDL being the bad cholesterol, HDL being the good cholesterol, LDL being the bad cholesterol, okay? And some people, you know, will say, well, my cholesterol is 195, so I'm okay. But that's not necessarily true, especially if you have previous heart disease or previous atherosclerotic disease. Your numbers need to be better than that. Especially the good cholesterol and the bad cholesterol, okay? The numbers we shoot for in people that have had heart disease, we like to have the good cholesterol, the HDL over 40, and obviously the higher the better, okay? We have to like to have the LDL less than 90, and ideally around 70 if you've already had heart disease, and there's no question when you get numbers to that level, the incidence of heart disease or prevention of heart disease is a lot less.
And now the next one that everybody hears about, but they really don't understand, is glucose. Blood glucose.
Right.
What does it mean? How does it affect heart health?
Well, very important. You know, glucose is important for metabolism in the body. All the cells of the body use glucose. And when you can't metabolize the glucose, or you have problems with metabolizing glucose, you can become a diabetic, okay? Clearly, diabetes or elevated blood sugar levels are indicators of heart disease, okay? And the higher the glucose and the worse the diabetes, the more poorly controlled the diabetes or the blood sugar, the more likely the evidence of heart disease or atherosclerotic disease.
How about a number that is a safe number?
A good number is, depending on the lab, anywhere between 100 and 110 on a fasting glucose. Now, if you go eat a heavy meal, even in normal people, if you go eat a heavy meal with a lot of sugar, your number is going to be higher than that. So all these numbers we're talking about are fasting, usually 12-hour fasting levels.
Triglycerides. Now, a lot of people hear about triglycerides, they don't know what the difference is between triglycerides and cholesterol, because they think it's fat. Right. So it should be the same, but it's really not.
They are. There are two types of fat, and there are two types of ways that the fats get transported in the blood. Triglycerides are very important in prevention of heart disease. The number we look for is less than 150, okay? And once again, depending on the lab, a fasting level less than 150. But, you know, triglyceride probably not as important as cholesterol, but still very important in the prevention of heart disease. I've seen people who had terribly abnormal triglycerides as their only risk factor develop heart disease. So just because you control your sugar, control your cholesterol, can't forget about triglyceride. Very important. We
got 30 seconds left. Hypertension is tied in with all of those.
Absolutely, and once again, the higher the blood pressure, the longer the person goes without treated blood pressure problems, the more the incidence of coronary disease or atherosclerotic disease. The numbers we like to look for are about 120 over 70, 120 over 80. They've revised those numbers lately in the last couple of years. Actually, the older you are, it's going to be more and more difficult to control your blood pressure around that level and feel good.
Dr. CeFalu, thank you so much. I'm looking forward to having you back again. This is a series about prevention and your health.